When Dr. Williams told me, "Mrs. Harrison, you're a typical hypochondriac. You don't have a real illness." He was dismissing the pain I'd been suffering for 6 months. While he was trying to drive me crazy, I discovered that his diploma was fake. And while I was getting my real diagnosis from another doctor, Dr. Williams would never be able to treat anyone again. Comment where you're watching from and stay until the end, because this isn't just a story about misdiagnosis. It's an expose of medical fraud. My name is Patricia Harrison. I'm 59 years old, and throughout my life, I've been someone who takes care of her health and gets regular checkups. I live in Phoenix, Arizona, and have worked as an administrative assistant at the same insurance company for 35 years. I never had any serious health problems until those symptoms started. It all began in March of last year. At first, mild headaches, fatigue, and strange sensations in my stomach area. At first, I thought it was stress. We were going through a busy period at work. Tax season was approaching, but the symptoms gradually got worse. The headaches turned into intense migraines. The fatigue became chronic. And worst of all, a burning sensation started in my stomach. Sometimes it was very painful, sometimes a dull ache. My eating patterns changed, and I started experiencing weight loss. I made an appointment with my family doctor, Dr. Robert Williams, who was covered by my insurance. His office at Desert Medical Center looked modern and professional. Dr. Williams was around 45, confident and well-dressed. Diplomas and certificates covered his walls. During my first visit, I explained my symptoms in detail. "Doctor, severe headaches, constant fatigue, stomach burning, weight loss." Dr. Williams barely listened. He did a quick examination, took my blood pressure, listened with a stethoscope. "Mrs. Harrison, everything seems normal, probably stress-related. Take some antacids for the stomach, get more rest." "But doctor, these symptoms are getting worse. The stomach pain is really concerning." "Mrs. Harrison, you look fine to me. Sometimes people your age worry too much about normal body changes. People my age? I was 59, not 90, but I remained respectful. Could we do some tests? Blood work, maybe x-rays?" "Not necessary. This is clearly stress-related. Take Tylenol for headaches, relax more." 2 weeks later, my symptoms were worse. I had lost 10 pounds. The stomach pain had become unbearable. I made another appointment. "Doctor, my condition is worse. I can't eat properly. The pain is constant." Dr. Williams looked frustrated. "Mrs. Harrison, I told you this is stress. You're making yourself sick by worrying." "I'm not making this up. Something is really wrong. Look, I've been practicing medicine for 15 years. I know hypochondria when I see it. You're obsessing over normal body functions. Hypochondria. I was shocked when I heard that word. Doctor, I'm not a hypochondriac. These are real symptoms." "Mrs. Harrison, classic hypochondriac behavior. You convince yourself you're seriously ill, then every minor sensation becomes a major problem." After this conversation, he prescribed anxiety medication. "This will help calm your nerves and reduce phantom symptoms." Phantom symptoms, as if everything I felt was imaginary. But the symptoms were real and getting worse. By April, I had lost 15 more pounds. The stomach pain sometimes doubled me over. My sleep was disrupted by chronic discomfort. At my third appointment, Dr. Williams was even more dismissive. "Mrs. Harrison, you're back again. This obsessive behavior proves my diagnosis. You have health anxiety disorder." "Doctor, please." "I've lost 15 pounds. This can't be anxiety. Anxiety can cause weight loss. You're not eating because you're worried about eating. Self-fulfilling prophecy. Could you please refer me to a specialist? Absolutely not. That would validate your hypochondria. You need psychiatric help, not medical tests. Psychiatric help, like I was crazy. Doctor, I'm asking for basic tests. Blood work, CT scan. Mrs. Harrison, you're wasting healthcare resources with unnecessary tests. This is exactly what hypochondriacs do. After that visit, I was completely frustrated. Dr. Williams was treating me like a delusional patient. But my symptoms were getting progressively worse. In May, I started doing my own research. Online medical databases, symptom checkers, medical journals. My combination of symptoms, severe headaches, weight loss, stomach burning, could indicate several serious conditions. But when I returned to Dr. Williams and mentioned my research, he became angry. Mrs. Harrison, this is exactly what I mean. You're on the internet, self-diagnosing, making yourself crazy. Classic hypochondriac behavior. I'm trying to understand what's happening to me. What's happening is anxiety disorder with somatic symptoms. Stop Googling diseases. Doctor, could you please just order basic blood tests? No, I won't enable your obsession. Take your anxiety medication and stop doctor shopping on the internet. Doctor shopping, another dismissive label. By June, my condition had reached a critical point. Weight loss had reached 20 pounds. Stomach pain was constant. And a new symptom, blood in my stool. When I saw blood in my stool, I panicked. This was definitely not an anxiety symptom. I immediately called Dr. Williams for an emergency appointment. Doctor, there's blood in my stool. This is serious. Dr. Williams examined me briefly. Mrs. Harrison, probably a minor hemorrhoid or small tear. Very common. This combined with all my other symptoms. Mrs. Harrison, I'm going to be direct. You have severe health anxiety disorder bordering on delusion. You're creating these symptoms through obsessive worry. Delusion. Like I was completely detached from reality. Doctor, blood in stool is a real symptom. Yes, minor bleeding happens, but you're catastrophizing normal body functions. This is a psychiatric condition. I want a second opinion. A second opinion will tell you the same thing. You need therapy, not more doctors. That night, sitting at home, I thought about it. Dr. Williams was confident, seemed experienced, had a medical degree. Maybe it really was a psychological problem. Maybe I was making myself sick with worry. But my body was telling me something different. The pain was real. The weight loss was real. The blood was real. I talked to my friend Carol about the situation. Patricia, if you feel something's wrong, trust your instincts. Get a second opinion. Dr. Williams says that's hypochondriac behavior. Patricia, doctors can be wrong too. Your health is too important. Carol's words encouraged me. I made a decision. I would get a second opinion without Dr. Williams's approval. I made an appointment with Dr. Sarah Chen at Arizona Medical Associates. They accepted different insurance coverage, so there would be an out-of-pocket cost, but health is priceless. Dr. Chen had a completely different approach. She carefully listened to my entire symptom history, took detailed notes, asked specific questions. Mrs. Harrison, how long have you had these symptoms? 6 months, getting progressively worse. And your primary doctor's assessment? He says I'm a hypochondriac. Everything is anxiety-related. Dr. Chen frowned. These symptoms warrant investigation. Let's start with comprehensive blood work and imaging. I felt relief. Finally, a doctor who took me seriously. The blood tests were comprehensive: complete blood count, liver function, kidney function, inflammatory markers, tumor markers. A CT scan was scheduled for my abdomen and pelvis. The results came back a week later. When I sat in Dr. Chen's office, her face was serious. "Mrs. Harrison, I have difficult news. Blood tests show elevated inflammatory markers and abnormal liver enzymes. The CT scan reveals a mass in your pancreas." The world spun. "A mass? We need a biopsy to confirm, but based on your symptoms and imaging, it appears to be pancreatic cancer." Pancreatic cancer. The words echoed in my head. "Mrs. Harrison, this is a serious condition, but we caught it relatively early because you were persistent about your symptoms." Early, because I was persistent, despite Dr. Williams calling me a hypochondriac. "Doctor, my family doctor said this was all in my head." Dr. Chen looked shocked. "Mrs. Harrison, your symptoms were a classic presentation of pancreatic disease. Any competent physician should have ordered tests immediately. Any competent physician." The biopsy confirmed the diagnosis. Stage 2 pancreatic adenocarcinoma, serious but treatable if caught early. Surgery was scheduled at Mayo Clinic in Scottsdale. Meanwhile, anger was building inside me toward Dr. Williams. For 6 months, he had dismissed my symptoms. 6 months of calling me a hypochondriac, while cancer was growing inside me. Treatment began immediately. The surgery was successful. The cancer was confined to my pancreas. The oncologist was optimistic about my prognosis because of early detection. But my curiosity about Dr. Williams remained. How could an experienced doctor miss such obvious symptoms? Either he was completely incompetent or something else. I began investigating Dr. Williams's background. In my online search, I found his clinic website with his credentials listed. MD from University of Southern California, internal medicine residency at Cedars-Sinai. I called USC Medical School for alumni verification. "I'm verifying that Dr. Robert Williams graduated from your program. Could you provide his graduation year?" The website listed 1995. 1995 graduation. "I'm sorry, we have no record of Robert Williams graduating from medical school in 1995 or any other year." No record. My heart started racing. I called Cedars-Sinai Hospital for residency verification. Same result. No record of Dr. Robert Williams completing residency here. I researched the Arizona Medical Board. Dr. Williams was licensed, but his educational background hadn't been verified in recent years. I hired a private investigator, Tom Rodriguez, a former police detective specializing in fraud cases. "Tom, I need a complete background check on Dr. Robert Williams." Tom's investigation was thorough. The results were shocking. "Patricia, Robert Williams never attended USC Medical School, never completed residency at Cedars-Sinai. His diplomas are forgeries. How is he practicing medicine?" He used fake documents to obtain his initial license 15 years ago. He's been practicing with forged credentials ever since. How many patients has he treated? Thousands. And based on your experience, he's probably missed multiple serious diagnoses. This revelation was devastating, not just for me, but for the countless patients Dr. Williams had treated with fake credentials. I compiled the evidence: forged diplomas, fake residency records, fraudulent license application. I filed a formal complaint with the Arizona Medical Board. An investigation was launched immediately. Dr. Williams's office was raided, records were seized, other patients were contacted for potential malpractice cases. The news broke a week later. Phoenix doctor practiced with fake credentials for 15 years. The story went statewide, then national. Dr. Williams was arrested on multiple fraud charges. His medical license was immediately revoked. A criminal trial was scheduled. Local news requested an interview. I decided I should tell my story to protect other patients. I suffered for 6 months while a fake doctor called me a hypochondriac, I told the news anchor. Real cancer was growing inside me, while he dismissed my symptoms as anxiety. What message do you have for other patients? Trust your instincts. If a doctor dismisses serious symptoms without proper investigation, seek a second opinion. Your life may depend on it. After the interview aired, my phone started ringing. Dozens of Dr. Williams's former patients called. Their stories were heartbreaking. Maria Santos. He told me my chest pain was stress. The real diagnosis was heart disease. James Miller. He said my fatigue was depression. I actually had thyroid cancer. Susan Wright. He dismissed my headaches as hormones. A brain tumor was found by a real doctor. A class action lawsuit was filed against Dr. Williams and Desert Medical Center for negligent credentialing. 47 patients joined the suit, representing years of misdiagnoses and delayed treatment. The trial lasted 3 months. Dr. Williams was convicted on 15 counts of fraud and sentenced to 12 years in prison. The medical center paid an $8.5 million settlement to victims. It was a personal victory, but the cost was enormous. Cancer treatment was successful, but psychological trauma remained. My trust in the medical system was shattered. But there were positive outcomes, too. Arizona tightened credentialing requirements for doctors. Regular verification of medical degrees and residencies is now mandatory. Exposing Dr. Williams saved other patients. Early detection programs were expanded. Medical fraud detection was improved. Today, I'm cancer-free 18 months later. I have regular checkups with Dr. Chen, who remains my trusted physician. I do health advocacy work, educating patients about their rights and warning signs of medical fraud. The most important lesson: never let anyone dismiss your concerns about your own body. You know yourself better than anyone. If something feels wrong, investigate until you get answers. When Dr. Williams told me, "Mrs. Harrison, you're a typical hypochondriac. You don't have a real illness," he was dismissing the pain I'd been suffering for 6 months. While he was trying to drive me crazy, I had discovered that his diploma was fake. And while I was getting my real diagnosis from another doctor, Dr. Williams would never be able to treat anyone again. Sometimes those who call you crazy are the ones living the biggest lies. Medical fraud is devastating, but patient advocacy is powerful. When we speak up for ourselves and others, we create change. We save lives. Dr. Williams thought he could silence me by calling me a hypochondriac. Instead, I found my voice and used it to protect countless others from his dangerous deception. Real doctors heal, fake doctors harm, and patients who trust their instincts, we survive and thrive. The cancer may have been in my pancreas, but the real sickness was in that office, and we cut it out completely.